Good morning. I am at an appointment today with my husband, so this is our notes for today. If you don't already have your notes packet out, please get it out. Feel free to pause me. I have to talk a little fast since I have a 15-minute time limit. And also don't forget that you can go back and redo this ed puzzle as many times as you want. It is graded, so please make sure that you do that if you want to earn all of those points. After this ed puzzle today, you will have an article to read with a partner or two. And some questions to answer. You are welcome to do that on one piece of paper. Just make sure you put everybody's name on it. With any time left, you can work on exercise 5 or other outstanding assignments that you have. Also, don't forget our last day for quarter 1 term projects is tomorrow, and your chapter 7 homework assignment is also due tomorrow. All right, so let's go. So today, our last topic for the axial skeleton is the spinal column. The spinal column is a structure that has 24 individual bones, and then the sacrum and coccyx as well. There's a lot of connective structures in the spinal column as well that provides for cushion and support and flexibility to those bones. So the function of the spinal column is to protect the spinal cord. So if we look at the spinal column and its component vertebrae, all of them have this little hole, and that is where the spinal cord will pass. So the spinal cord is made up of primarily nervous tissue, some connective supportive tissue around the outside, but it is very delicate and needs protection. So when we start at the superior region of the spinal column, that's the neck region, we call these 7 vertebrae the cervical vertebrae. Once we get down into the chest area, we call these vertebrae the thoracic vertebrae. There are 12 of those. And then underneath that, we have the lumbar vertebrae. So really the transition from thoracic to lumbar is when we no longer have ribs that are attached to them. The lumbar vertebrae are the lower 5, and then we will transition to the sacrum and the coccyx, which will be the attachment points for the hip. So here's a nice model showing all of those vertebrae. Notice that in each section, they are numbered with number 1 being the most superior, and then they're numbered accordingly. They do restart in each section. So a lot of times you will hear these vertebrae referred to just as the first letter and then the number. So like this one would be your C6 vertebrae, or your L11 or your T11 vertebrae, or your L3 vertebrae. So that is where that notation comes from. So a normally developed spine, besides having the bones and the connective tissues, also has a couple of curves in it. So these curves are important to help a human maintain their balance and to be a shock absorber during locomotion or movement. And so a normal spine does have a normal curvature to it. And you can see the second one has an exaggerated lumbar curve, so we call that lordosis. So notice here, there's a slight curve in the normal one way on the left, but this second one has that lumbar curve where it's kind of sticking out. Lordosis can actually be very common for people that are carrying extra weight around their midsection, or for pregnant people. As you get to the end of that pregnancy, you might be carrying 15 to 20 pounds of baby placenta, amniotic fluid, all of that stuff. And so lordosis is kind of a common thing that happens, and it is correctable after the baby's born. Kyphosis is when you have this kind of hunchback appearance where the thoracic curve is exaggerated. So again, you can see the normal curve and then that exaggeration. This is really common in people that have osteoporosis. A lot of times those cervical and thoracic vertebrae lose a lot of their bone mass due to age or due to loss of hormones in females that are postmenopausal. So that is less treatable, and usually that is going to be permanent. And then we're probably all familiar with scoliosis, the most common skeletal deformity where you have a lateral curvature. A normal spine should not have any lateral curvature. It should be straight from the base of the skull down to the sacrum. But here we can see a little lateral curvature, which can usually be corrected with physical therapy, bracing, or sometimes surgery. So here is that curvature of a normal spine. So you can see that we have a little anterior curvature in the cervix, posterior or cervical curvature, a posterior curvature in the thoracic area, and then another anterior curvature in the lumbar area. So I mentioned that there's a lot of connective tissue that helps support these vertebrae, the most important one being the intervertebral discs. These are little pillows of connective tissue that will begin from the second cervical vertebrae, so C2, all the way down between L5 and the sacrum. There also is an intervertebral disc. So it's many layers of cartilage. Some of it is fibrocartilage, some of it is a little bit denser. And again, that just helps to absorb shock and to create spaces between the vertebrae so that we don't get compression of the nerves. Besides the spinal column going through there, there are also spinal nerves that come off each side that will pass through a lot of different passageways in our vertebrae. So if we don't see the entire spine altogether, we have to be able to identify the different types of vertebrae. So they come in lots of different sizes and shapes. Here's an example of a little cervical vertebrae. It's quite small, and this is one of your largest lumbar vertebrae. So you can see that they are very, very different in size and shape, and of course that depends on what the function of them are going to be. But all the vertebrae have some commonalities here, where you can see the vertebral arch, which will just surround the spinal cord here, shown in yellow. We have a vertebral body, which is what supports most of the mass. And remember, as you go posteriorly, the vertebrae is carrying all of the weight of the vertebrae above it. So that's why these lumbar vertebrae have to be really big and bulky, because they're actually holding up the head and all those vertebrae on top of it. Sticking out on either side laterally are the transverse processes. And then we have articular facets, both superior ones on the top and inferior ones on the bottom. Those articulate or touch, make a joint with the next vertebrae above and below. We have some spinous process that sticks out the back as well. And this is a typical thoracic vertebrae. So they will be a little bit different in those specific parts depending on the type of vertebrae. So I also mentioned that we number our vertebrae from superior to inferior, and you should be able to recognize the different types of vertebrae based on their shape and their size. So first we have the cervical vertebrae. These are found in the neck. Some characteristics of the cervical vertebrae are going to be a smaller body. Remember that the body is just this part right here. A larger vertebral arch and a large vertebral foramen. So the arch is going to be this top part, and then the foramen is that passageway where the spinal cord goes. So compared to this overall size of the vertebrae, that foramen is very, very large. Now we have two specific cervical vertebrae that are special enough that they get their own names. C1, also known as atlas, and C2, which is also known as axis. So the name Atlas comes from the Greek god. If you can think about, there's a sculpture of a man that's kind of kneeling down and has the whole world on his shoulders. That was Atlas. That was the Greek god Atlas. And so Atlas, our C1 vertebrae, holds your skull on top of it. So if you think of your brain and your head being the world, Atlas does hold up the world. So you can see Atlas has very specific structures. These are called these will articulate with the occipital processes on the back of the skull, and it will, so we call those the occipital condyles. We also have a very, very large vertebral foramen because the actual brainstem goes through there. So that's really, really important. It still hasn't fully gotten small enough to be considered just the spinal cord. And we have no vertebral body. So this is C1. Atlas holds up the world. And then axis is C2. And its special feature is this little peg on the top that's called the dens. So if we look at how these two articulate, they hold together very, very nicely. And that actually allows for really great locomotion. And it's the reason that we can move our head in pretty much any direction. We can look up and down and sideways, and it gives us a very large degree of motion. So that little peg there is called the dens, and again, a very small vertebral body. Other than that, the rest of the cervical vertebrae are much more typical looking. So here you can see the articulation of Atlas and axis, and then the rest of the vertebrae. So this is a posterior view. The spinous process is always pointing backwards. Another thing I wanted to mention, with a typical cervical vertebrae, we have these transverse foramen, these little holes on either side. This is where the cranial nerves go. So the first 12 sets of nerves that come immediately off the brain, and the spinal or the brain stem are going to pass through these little openings. So we don't see those transverse foramen in other types of vertebrae. So that's how you know you're looking at a cervical vertebrae. Also, the spinous process is forked. The word we use for that is bifoid, bi meaning two. So that forked spinous process, those two transverse foramen, and it's little, okay? The cervical vertebrae are going to be very little. All right, so our next group are the thoracic vertebrae. Thoracic vertebrae have articular structures for the ribs. So we call these the facets, and otherwise they're just your average, middle-size vertebrae. Here you can see how they attach to one another, so they do get larger as you go down, and all these little lighter areas on the side are where the ribs will attach. Lumbar vertebrae are the biggest and the bulkiest. Again, they're pretty heavy, and if you wanted to get into my box of bones and pull some out, they're significantly heavier because they have to support all of the body's weight. We still see a lot of the same basic processes though. Transverse process, spinous process, that's always going to point down, and a very bulky vertebral body. So here you can see all three of them compared to one another. These aren't really to scale. In reality, the cervical is quite a bit smaller than the lumbar. So make sure that you can identify each of these. So our last part of the axial skeleton is going to be the sacrum and coccyx. So these are actually attached in my box of bones. The sacrum is going to be this top part, and it serves as the foundation of the pelvic girdle. So we will attach our coxal bones or our hip bones to either side of this. And then the coccyx is our little tailbone here. It's actually 4 vertebrae that fuse together, and it really doesn't serve a whole lot of purpose. It does anchor some of the connective tissue that surround and protect the spinal cord, but all in all, it is kind of a vestigial structure. We inherited it from our ancestors that had tails. We don't have tails anymore, so that little tailbone is kind of reduced in structure and function. Okay, so sternum is last bone we're going to talk about today, and it is a flat bone located right at the center of your chest, and it has 3 basic parts here. We have the manubrium, which is at the top, the body, which is in the middle, and that's where all the ribs attach, and then our little xiphoid process here at the bottom. We have a couple other structures that are notable. The suprasternal notch you can kind of feel right here on your neck. And then the clavicular notches on the left and right sides are where the clavicle attaches. So we've mentioned the ribs a couple of times. These are flat bones that provide support to the thoracic cavity and protect our lungs. We do classify our ribs according to how many connection points they have. The top 7 have connections on both the sternum and the vertebrae, so they are true ribs. The 5 inferior ribs either connect indirectly or don't connect at all to the sternum. So if we go back to our picture here, you can see how a couple of these are kind of floating at the bottom. Excuse me. Okay, so just a couple disorders we can squeeze in here. A herniated disc is when the cartilage capsule kind of pops and it sticks out. A hernia is always when something is sticking through when it shouldn't be. And so these can be caused by physical injury, and they can be very, very painful. Another disorder is called spina bifida. Behind my head here is kind of gross, so don't look if you don't want to. But spina bifida is a congenital disorder, so this develops during pregnancy and where the spinal cord is not fully fused. So this baby, depending on severity, can have really poor movement in their legs, but usually it is treatable and they can correct that with surgery. All right, so that wraps up all of chapter 8 or chapter 7 for you guys. Please make sure that you finish up the NASA and bone loss activity. And with any time that's left over, you can read. Remember, AR points are due tomorrow, or you can work on your next homework assignment. Send me a remind or an email if you have any questions, and we'll see you tomorrow.